2. Anabela is a registered dental hygienist. She also is a nutritional therapy practitioner. And she is practicing consultant at the Wellness Solutions. Her industry expertise includes NTP certification since 2008 from the Nutritional Therapy Association in Olympia, Washington, serving patients and professionals on their nutritional and health needs. She's a mother of 2, and she is our chief nutrition consultant. And with that, Anabela.
Thank you, thank you, thank you, thank you. So everybody has a copy, right? All right. So there's 2 parts to the test. So when you fill out your questionnaire, so you will get the test kit, you'll fill out on the computer a questionnaire. So part of the reporting is going to be the information that comes out of that questionnaire. Your weight, your height, your stress level, your eating, your bowel details. And then the other part is going to be a stool swab. It is not a stool test like some kids. You have to collect a stool sample. You don't have to do that. It's literally just a Q-tip, and all you do is have to soil the Q-tip. That's all it is. It's very easy to do. Put it back in the cylinder and you mail it out. And that's where the gut score comes in. So the questionnaire that you fill out, the insight information, and then the gut score is coming from the sample that you give. They put them together, and this is where the recommendation at the end, which I'll go over, is how they come up with the recommendation. So it's really a comprehensive way to determine what's going on with your microbiome. And they've been doing a lot of research more and more on the microbiome because we now know the microbiome affects everything in your health. We always thought the microbiome, we always thought probiotics. Microbiome is probiotics, right? That's what we always thought. The microbiome really is genetic material of viruses and parasites and funguses and bacteria, and this genetic material communicates with each other. So the communication has to express itself. And how does it express itself? I gained weight. I have sluggish stools. I have headaches. I don't feel good. Multiple things. I have inflammation. I have pain. And these are the symptoms that we're feeling. So we know that we tie it back to the microbiome. So that's why this test is so valuable, because it will actually, when I explain it too, it'll give us all the connections as to what's going on in your body. Okay, right. So I'm going to go by the gut score first. So that's this sheet here. So we'll do the insights last. So just this sheet is what I'm going to go by. And you literally have what I have, so that way we can follow together. Okay. So what you're seeing here is literally a snapshot of what's going on in your microbiome at this time, which is really current, which is nice. You'll see a gut score, you'll see a circle here, you'll see 4 different categories, and you'll see a number. It'll be 3 out of 10. So 10 is the highest score that you can get. Unfortunately, because I feel a real pandemic is our lifestyle and our diet choices. That's a real pandemic because it's affecting everything about us, our health. And the average, that biome, the company biome, their average is 4 to 6. They rarely get a 10, which is sad. It really is. But it's what's happening. So 4 to 6 is what they get, the average. So right here, you'll see a 3. This person needs to work at it a little bit. So there's 4 categories. There's the phyla balance, which you'll see on the right-hand side. That one holds the most weight. 40% of the information from this phyla balance is how they make this report. And then the microbiome diversity is 30%, and then beneficial and pathogenic species is about 15% each, just so you know what the categories are. So we really take a lot of information from that phyla balance. That's really one of the most important ones. And I'll talk more about that. So the microbiome diversity, that'll be the first thing that you see on this page. That will be the first thing that they show you. You can see what the score is, 2 out of 10. The nice thing about this report is it comes in the results come in a nice emoji, so it's really user friendly, and it'll be in a few colors. It'll be red, it'll be orange, and it'll be green, and yellow, I believe. So it's pretty clear. It'll have the smiley face, the neutral face, the really sad face. So it's really user-friendly. So when you get the report, this is something that you can immediately get the report and go through it and know what you're seeing without the doctor having to interpret everything for you. And that's what I like about the results too. It's really user-friendly. So you can see with the red face and the sad face, it's 2 out of 10, which is not a good score. So there's many different kinds of bacteria and fungi in your microbiome, and that's what the diversity is. So this person's diversity is really low. So there isn't just enough of the good, the good and the bad, the good of the fungus and the bacteria. So going to the second page, we're get down to the highest part of the most important weight, which is the phyla. Phyla, I know these are, heavy words, but phyla is just a group of similar species. That's all that is. It's could be beneficial, it could be pathogenic, it could be neutral. We care about the pathogenic and the beneficial because that's what's given us results. So we use 5 phylas. These are the phylas in microbiome. I don't work for biome. The phylas, these are the most researched and the most important phylums. That's what they use. So the first one is a Bacteroides. These are really, big words, but I'll just say the first one. This is one of the most abundant phylas. This is the one that you want your test scores to be in the green. I know you don't have color, so I apologize. But you will get you'll get your report in color when it comes, but you want it to be where the green is, okay? And the result for this person is red, so we know that we're not in a good range. We should be somewhere in the green. This is one of the most important phylas. This is if this phyla is off, this is where we get fermentations of proteins and carbs. What does that all mean? It means when we have gas, bloating, we don't feel good. And we think, oh, it's something I ate, and it's the biome, it's your phyla that is not there to help you with fermenting these carbs and these proteins. So that's why this is just how important our microbiome. The second one is responding to fats. So a lot of people who have, if their stools are very watery, or if they eat a fatty food and they can't digest that properly, that type of Firmicutes, that phyla is off. If your numbers are kind of low with this, it means that your fats are bad or you're not eating enough fat. If your numbers are high, you're eating too much saturated fat. How I look at this, if I was interpreting it and you were my patient, I would say you have some issues with processing fats. That's when I would get into AF beta food or Colo-Cal, something to help you digest those fats. We know that the phyla is off, but it's because you're not digesting those fats. So that's when I would get into something like that. Your third one, your proteobacteria, this is the indicator of inflammation and dysbiosis. This is a really important one. So if this one is off, and as you can see in this one, it's a red, sad face. This person, if I see this, I know off the bat this person has inflammation and dysbiosis. So immediately they would be the ones to have pain or their C-reactive protein is high, those kinds of things. Stiffness, pain, this phyla is off on them. And then the last one, this is a fungal marker. This is really important. This is one of the most common phylas. It's very protective for anti-inflammation. So again, well, this one happens to be a good face, so that's good. So if I see the proteobacteria and the last one, and they're both, like not happy faces, that person's got a lot of inflammation. So these are just keys to wow, this makes a lot of sense. And so when we're taking, don't get me wrong, we have a lot of great supplements. You're in pain, we have great turmeric and boswellia and all these great supplements that work and patient feels better, but we need to fix the microbiome. We need to get down to that. So then let's go into the next one, which would be beneficial species. So these are the species. Remember, these are the ones that are like 15%, the species. This is nice because shows me this is what's going on in your gut. These beneficial species tell us a lot. They provide, your beneficial species provides benefits for you. If your beneficial species is not okay, you know that there's some sickness going on. And there's 5 bacterias and 2 funguses. That's what we test. So the first one, the bifidobacterium, these are your big guns. Bifidobacteria, we hear about that a lot in yogurts and things. That's why. These are your big guns. These are the anti-inflammatory bacteria that regulates that inflammation. So if your level is high, your health issues are low. And in this person, it has the red face that's very sad, so they're really low. They're nowhere near high. So I already know this person has inflammation. They definitely have some health issues. So I would say, so what's going on? They're like, oh, I'm pre-diabetic. I have, a sore shoulder. I have, thyroid issues. There's definitely going to be something there. You could see it in the report. The next one is, this one's important for your immune system. And I'm just kind of going through these so you could understand how valuable this bacteria is for everything going on. This one's really important for your immune system. The next three that are here, these are big guns too, because these are what regulates your fatty acid production. Fatty acids we need to break those fats down to fatty acids. You want that. But people think, oh, I eat fat, I'm gonna get fat. It's not what happens. As a nutritionist, I'm telling you, that's not what happens. That doesn't correlate. You don't eat fat and you get fat. You get fat because you're eating carbohydrates, insulin that's not being burned off, and they store as fat. That's where that comes from. So that's a misconception right there. So we really want to have fats, and we want to break them down to fatty acids. But I already know this person's not doing that, because we saw in the other report that they weren't breaking down fats, right? So we already know that I could just tell that this is going to be a face that's sad, because I saw it in the report before that they had issues with those fatty acids. So we want to make sure that those are doing good. And then the last three these are fungal. These are beneficial fungals. They help balance your gut. Everybody thinks, oh, fungus is so bad for you. They're just pathogenic. They're not all pathogenic, I mean to say. They're not all pathogenic. They're there to keep bacteria and inflammation in check. The problem is when something goes up too high. And in this situation, you could see where their Saccharomyces is the sad face. The red sad face is very, very low. So I know that they already have to have some kind of gut dysbiosis because the fungus is too high. And if the fungus is too high, it's not going to keep the bacteria in check. Okay, so that's how we can read that. And then the next page, these are the pathogenic species. These are the sad ones. These are the ones that we really want to make sure that they're okay. And these are all going to be opportunistic. These are not good ones. These are opportunistic. And they're 2 bacterial and 3 fungal that they use. I keep saying that they use. When you have these pathogenic bacterias and they're out of balance, this is what's causing disease and inflammation and damage to you, right? Your arteries and all those kinds of things. So if you have any Clostridia, which we shorten it by calling it C. diff, right here in this one, again, I'm sorry you don't have color, but it's a happy face. So this person, their C. diff is good. It should be good. This one needs to be as low as possible. There's a very short range and it needs to be there, because if anybody has C. diff, they have a lot of health issues that needs to be controlled. Sometimes they need to take, prescription medication, or they need to go through a protocol to get that C. diff down. The next one is E. coli. Everybody hears E. coli and they're like, of course that's bad, right? But there is a beneficial E. coli actually, but there's a Nacelle is actually a beneficial one. It's a protective one, but this E. coli that we're talking about here, very pathogenic, very problematic. We can't have that. If we see E. coli here, which in this person that has the sad face, they need to work on that. That's important. And then the last 3 are funguses. These are the candidas. They're pathogenic. They could live harmonious, but because they're too high, they can't. Remember, candida and fungus, they keep bacteria in balance, but it can't be overridden. And in this case, the person has some good and some bad. The last one to finish the gut report, these are additional species. These additional species are not in your report, meaning they didn't influence your report, is what I mean to say. These species they don't have very big research behind it like the other species. That's why those species are in the report. They have big research, we know about them, we use those. But these aren't big hitters, or should I say big research, and the ranges are very short. So if the ranges are very small, they're just not affecting you as much as those big hitters like I was talking about before. So you can review those when you get them and you see the happy faces, the medium faces, the happy faces. It's for your knowledge and for your knowledge, the doctor's knowledge. If they want to put something together, they might go to PubMed. If you ever want to research something like PubMed, you could punch in this type of bacteria or this species or phylum that are in here because they're mixed, and you can kind of get some information and maybe connect some dots for you. But just so you know, this last 2 pages, they're not any information that's included in your report. All right? Does anybody have any questions with just the gut score? I didn't want to throw too many hard things. It gets complicated, but I'm glad you can at least follow along so that it makes it easier for you. But does anybody have any questions on the gut score or want me to review or clear anything up? Sounds good? Mm-hmm. Okay. So then the next report will be the insight report, right? So this one is going to tell you, these are the things that we need to change or to add, right? So that we know about all the pathogenic stuff and all that, right? This is gonna be the nitty gritty. What do we do about it? What am I gonna do with all that information? So then we have some insights. The first one is, this person needs to eat more vegetables, increase antioxidants, fiber, and detoxification. Remember, detoxification isn't like this big, complicated, scary thing. Detoxification is you drink water and you're detoxifying through your kidneys. You eat fiber, you're detoxifying through your stool. So detoxification is something, you can eat greens, you can eat dandelion and drink dandelion tea, you're detoxifying. So don't think of detoxification as this big scary word. It's something that we do and we should be doing on a regular basis every day. So the reason why this person needs those recommendations is because of the Bacteroides that are in there. That Bacteroides level was off. So this is what they're doing. They're getting the gut report, what they found, they're tying it in with the lifestyle, the questionnaires, and they're making this, right? They put them together. So when that species is off, we know that person needs fiber because fiber is really important to make good bacteria and things like that. The second one is to reduce sugar and carbohydrates. Why? Because this person, their candida was very high. So we already know in order to get candida, we need to stop what's feeding the candida, which is going to be the sugars and the carbs. All right, so that'll be that. And then the other one, the last one, will be the anti-inflammatory foods. What are they? Those are vegetables, some fruits, herbs, spices, and fish oils, because they're very anti-inflammatory. And why? Because this person has proteobacteria that was elevated, and that's a big hitter for inflammation. So that's how they take all that information, okay, and put it together. So then we keep going on, and obviously, most people are going to have some kind of stress hitter. This person does. So part of their lifestyle is they have to incorporate breath work to reduce stress. Why? Because proteobacteria was elevated, and that bacteria is related to inflammation and digestive issues and so forth, and stress really affects that. And then the other recommendation is this person needs to reduce their body weight. How do they know that? Well, number one, your lifestyle tells you, questionnaire tells you how much you weigh, but the bacteria that's in here, the species that's in here, you won't have that if your body weight is normal. So they just put all of this together, So again, when we think, wow, I have to lose weight, I gotta go on this crash diet or do Jenny Craig, or I gotta exercise more. All right, we do maybe need to eat less, we do have to exercise, but you gotta balance the phyla and the species that are in here, because that's part of it. And then the next page is gonna go over some recommendations. They are going to recommend supplements to balance your microbiome because the person's motility and stability of their stool is not where it should be. So they need to support there. They need some stress support, so they recommend some adaptogens, and they need some digestive support, they recommend fiber. So that would be the recommendation there, okay? And then the next pages, which were towards the end, this is what they recommend. I really, really love this program, and keep in mind, I don't work for Biome. I just love these reports because it's great when you get all these reports, but it's up to the practitioner to now interpret it and give recommendations. And that's great, we still have to do that, but they actually give you the products that work for your microbiome. And that's what I love. So it's individualized to you. not me saying, I think you should take probiotics. You might not ever need a probiotic. You might be 100% all stress and maybe just need fiber. So that's what I love about this. So it takes that guesswork out of there and it gets you the products that you really need to fix your microbiome. So this first product would be, and I'll just in brief just tell you about some of the products. This berberine active, this is an herb that is really good for bowel environment and for liver. And with the species and phyla this person has, that's why they needed that. The next one is, I love this product, ashwagandha. I take it every day. I can't talk enough about it. It's an adaptogens. Adaptogens are really, really unique because it's not a supplement or a medication that upregulates something or downregulates something. Blood pressure medication, down it. You know, if you have an infection, steroids, up it, right? This is what we're doing. And then it's throwing things off. Supplements work a little different, but sometimes they do that also. But adaptogens don't do that. Adaptogens work on the environment of not upping and not downing, just regulating it. And that's what I love about it. So I love ashwagandha. Me personally, as a nutritionist, everybody needs it for multiple reasons because it's an HPA axis controller. It's the hypothalamus pituitary adrenals. You can look it up. It's called HPA axis. I really don't know why medical professionals don't talk about it. It's in our anatomy physiology book, but it regulates that HPA axis so that it's constantly cycling so that the brain, the adrenals, your hormones, everything is working and regulating. It works on inflammation. It works on regulating your sleep cycle. It works on stress, an amazing stress. It's for children that are not thriving, they thrive. It's just an old ancient herb. I just absolutely love it. So I'm sorry, I won't keep going on about it. But yeah, as you can see, I really love it. All my patients do really well on it. So that would be because this person had a lot of stress. That's why the ashwagandha is in there. Then the next one is fiber. It's probably going to be in most people's reports because we eat the standard American diet, SAD. The acronym is SAD, Standard American Diet, which is void of fiber. We're not eating enough of it. So we have to take it in a supplement form, unfortunately, but it is what it is. Whole Standard Process, again, most of their product ingredients in their products are grown on their farm. So they're not synthetic chemicals, they're actual food and they work. So whole food fiber is from their farm. They take these different ingredients and they put that into their product. This is whole food fiber is great because it's soluble and insoluble. And not to throw more terminology on you, but you're gonna hear about it, so now you'll know what it means. Some fibers are all soluble. It does not get digested. It's just like a Brillo pad through, a good Brillo pad through your intestines, bulks up the stool because it takes water in, bulks up your stool, you go to the bathroom, you're happy. That's a soluble fiber. And insoluble is water, it breaks down in water, turns into a gel. And when it turns into a gel, it improves your digestion, lowers your cholesterol, lowers your sugar. That's what fiber does. So that's great. So just so you know, there's a difference between soluble and insoluble. So your report will come up with one or the other, or both. This one happens to be a mix of soluble and insoluble fiber. So this person needs both, okay? So when someone says, oh, I'll just get fiber from somewhere else, what kind? Is it soluble? Is it insoluble? What's in it? There's a lot of irritants in fiber. Remember, fiber is a Brillo pad. Should be a good Brillo pad, but sometimes it's not. And if you have a lot of inflammation in the gut and you take a lot of fiber, you're gonna create more problems. So you have to be really careful. And this type of fiber is vegetables and stuff that they grow on the farm. So it's a little different than some of the other fibers that are sold. And then the next product is Easy Mag. This is a very interesting supplement. So for those of you that are not on magnesium, I would recommend it. But be careful with your magnesium because the magnesiums that are sold are synthetic. If you have, we know about milk and magnesia and magnesia that help with like going to the bathroom, right? You have to be careful with some of the magnesiums. They're irritants to the intestines, and that's why you go to the bathroom. We don't want these irritants. So Easy Mag, this is grown on the farm. It's buckwheat. It's ingredients that they grow on the farm and Swiss chard. That's how they get their magnesium. It's food-based. There's about 2 to 3 different forms of magnesium that's measured in this product because it's food-based, which has natural calcium and a huge amount of potassium. So when you're taking these minerals, you can't isolate minerals for too long. They're in synthetic isolates of minerals. You can't just take magnesium, you can't just take calcium, and a lot of people do that. You gotta get it from your food source so that it's natural, so that the body works synergistic. Make sense?
Yeah.
And and just as a side note, for people that want quercetin because of COVID, this product has tons of quercetin. It's natural quercetin. The Easy Mag, just so you know, has tons of quercetin in it.
What's quercetin? I never heard of it.
Quercetin is an herb. Quercetin, it's a supplement. It's called quercetin. But most quercetins are, it's a nutrient, but most quercetins are synthetic because they're not getting it from food. But we put, our products are made from food. So now the label doesn't say that. So you're not gonna be like, oh, it's got quercetin. You're gonna tell somebody it's got quercetin. They're gonna be like, it's not on there because we're not branding it that way. That's why, but we know it has tons of quercetin in it because of the Swiss chard that's in there and the buckwheat, and it has a lot of quercetin in it. But the interesting part of this magnesium, before I move on, is it crosses the blood-brain barrier. Now you're like, yeah, so? What does that mean? Doesn't everything? No, it doesn't. Not everything does. Our turmeric does and our Easy Mag, magnesium does. What does that mean? When it crosses the blood-brain barrier, it goes to the brain and reduces inflammation in the brain. Like our turmeric forte will reduce dementia and Alzheimer's and brain inflammation. So that's a big one, huge, because we all have that. And some of us have it more. How do we know? Because we have symptoms of it. We forget, we can't think clearly. You know, people have ADD or some autism, you know, there's brain inflammation in there. So this Easy Mag crosses the blood-brain barrier, which is really impressive. One dosage of Easy Mag is measured in the cerebral spinal fluid. One dosage. Now I know that must be like, what does that mean? It means a lot to us people who can measure that and for who understand nutrition. That's huge. The only other magnesium is thionate, which is synthetic, that does that, crosses the blood-brain barrier. So the other magnesiums don't. So that's an interesting product, amazing for sleep. It helped me with sleep immediately. Stress, it's for the nervous system. Okay, you know, besides it being a mineral. And the last one I'm gonna speak about is prosymbiotic. This person needed a probiotic. But what's interesting about, again, that's another very generic, oh, just take a probiotic, I'll just go buy it at CVS, probiotic. And you have to be careful with them because majority of those probiotics are dead, they do nothing in the system. You could read the label, it's got 3 billion, wow, this is great, right? It's got 3 billion, it's 3 billion of nothing. Because they're not, the way they're manufactured, they're dead, they do nothing. So this prosymbiotic is actually a probiotic and a prebiotic. You might have heard that because now more people are talking about it. Probiotics are bacteria. Those lactobacilluses and bifidobacteriums everybody hears, it's in yogurt. Those are the big hitters, the big bacterias. Yeah, we need those. We need to replace them back in our gut. The prebiotics are the food for the big hitters. So you can't just keep taking big hitters, big hitters, big hitters. You gotta fertilize, right? You want that beautiful grass, you can plant all that great grass, the big hitter, but you gotta fertilize it, right? For it to maintain itself and for it to keep growing and to proliferate and get thicker and bigger, right? So that's what the prebiotics are. This product has both. Sometimes it might come up that you might just need a prebiotic. That's what maybe the recommendation is, but this product specifically is pro and prebiotic. So it's gonna help with regulating your bowels and your immune system. So when they talk about your gut and it's your immune system, it's 85% of your immune system. So you can see if the microbiome is off, you can see how connected that is to your health, you know, severe health issues. I think that's all I'm gonna talk about for this. I know I threw out a lot. Does anybody have any questions about this insight? I know you had a question, I'm sorry.
No, it's okay. Is there a best time of the day to take the ashwagandha?
That's a good question. Ashwagandha is adaptogen, you could take that anytime. So I take my ashwagandha sometime during the day, and I always take my ashwagandha at night before I go to bed because it regulates sleep cycles. keep in mind, guys, these aren't, we're so brainwashed to think medication, right? Oh, it's gonna put me to sleep. It doesn't put you to sleep. It will facilitate your natural sleep cycle. And you have one, you just didn't tap into it. Medication hides it or accelerates it or whatever. This is actually gonna accentuate what your natural sleep cycle is. You just hasn't been natural too long. So I take it at night. That's when I do it because it puts me in, it facilitates my sleep and it gets me more relaxed. And so the ashwagandha is really great. So that's a good question. And some people who have really stressful jobs, I tell them take it the 3 times a day. Take it during the day, in the morning, take it in the afternoon, and then at night so that you can sleep better and shut down the brain. It doesn't shut down the brain, but
Yeah,
you know, it gets that
right.
mode. Yeah. Mm-hmm.
Cool.
Anybody have any other questions? Anything you want me to review? Something I didn't review?
Just one thing I wanted to add on top of yours is for everybody that's here, something that we found interesting is that all the doctors did the biome test when we came here, when we first got it. And as far as the insight she's talking about, you know, there is no cookie cutter type of recommendations they have, because what we all decided to compare our results, and each of us had totally different
Right.
recommendations, totally different supplement things that they were telling us to take. So it isn't just oh, you're overweight, you take this. Oh, you know, you have a bacteria problem, take this. You know, everyone had totally different things that we're supposed to take. So,
Totally.
yeah.
Yeah, that's good that you added that. Like when I did mine had a lot of stress. Mine was a lot of stress, but you know, I have 2 professions, I have 2 kids, and I do a lot, and I lecture, and I just do a lot. So it didn't surprise me. It didn't surprise me, you know, but. Oh, did you have a question?
I did. Is there any interaction with medications that you might be on?
That's a really good question. So the magnesium, no, is not gonna have that. So all these products that we talk about they're safe with any medications. So if you're taking medication, your doctor will be like, yes, you could take a probiotic, yes, you could take magnesium. A lot of these medications even sometimes have these as catalysts. So they have the magnesium, but they're synthetic. So that's a really good question. If you take the turmeric forte, that is so heavily researched. That doesn't interfere with, you know, with medication. So, but that's a really good question, and you can ask the docs, and the docs can ask me. So, you're gonna get some of these brochures, and I just kind of put the basics, like my favorite, ashwagandha forte. My favorite, I had to give you that. So a little information on that. The turmeric forte, which I just love because of crossing the blood-brain barrier, reducing inflammation, works on depression, helps with depression, inflammation, pain. We know that turmeric is very well researched in cancer and supporting, you know, cancer and things. So for the turmeric forte, it's very strong because, and don't take strong as a bad thing, very strong because it crosses the blood-brain barrier. And once it crosses the blood-brain barrier, it can actually float in your bloodstream up to 8 hours, which is unheard of. So this turmeric opens up, it gets activated, the curcuminoids get activated, and it can float in your bloodstream for 8 hours. That's why it works so well, which is very uncommon for most turmeric. Then of course the Easy Mag, so you'll get something like that. And then this one I didn't talk about, this is called GI Stability. This is just a prebiotic. I don't have a pamphlet for the prosymbiotic, but I had one for GI Stability. This is just a prebiotic. Some people just need the fertilizer, and that's what the prebiotic is. This happens to be a chewable, so if you want to eliminate some of the pill fatigue that people have between medications and supplements, this is a chewable. Okay, so these are, you'll get some of these, so that way it has great information on it. And I don't want to over talk because I can lecture for hours, as you know.
And one of the questions I had
Uh-huh.
that I think everyone would love to know the answer to is, if this protocol was given to them as a solution, when can they start seeing results? Like in a day, a week, months? How long does it take to really make a microbiome change?
Right. So I'm going to answer that in a couple of ways. You would want to repeat the microbiome test in about 4 months, because that's how you can assess it, through a microbiome test to see change. So that would be 4 months, excuse me. But that is also following the insight recommendations and the protocols, right? The microbiome is going to change just because I want to change. You have to be proactive with it. So every 4 months or within 4 months to see the change. Now on the other side of that is when you're on targeted nutrients, whether it's food or exercise or supplements or stress reduction, you can feel a change within 24 hours. Just simple breath technique for stress, which is breathing in for 7 seconds, breathing in for 4 seconds, holding it for 7, exhaling for 8. You repeat that a couple of times, all of a sudden you're like, was I mad? Changes just like that. You don't have to wait for results. Something as simple as a digestive support because you're very bloated and you're very gassy, and the docs can give you something very easy to help with that overnight, or just as soon as you take the pill, there's relief. There's supplements that every time I eat something really fatty, I get the burping and all that. We give you the right supplement, you can eat that fatty food and you're great because now it breaks down the fats. So you can get results right away, you can get results a couple of weeks depending on what the situation, but definitely retest yourself in 4 months because that's how we really can assess where your microbiome is.
Well, thank you so much, Anabela. I
You're
want
welcome.
to say thank you for all of our patients. Why don't we give her a little hand?
Oh, thank you guys.
And one of the things that I appreciate about you is that you're so thorough. Your
Oh, thank you.
in-depth knowledge is just fantastic.
Oh,
We'd
thank
love to
you.
have you out here again sometime.
Anytime.
Thanks again.
Anytime. We'll come back in 4 months after you guys